Hello, my name is Nana Mokhtari, and today is August 23rd, 2019. Today I'm going to speak about the integumentary system. The integumentary system is composed of the skin, nails, hair, and glands. Specifically, the integumentary system is composed of epidermis, dermis, hypodermis, hair, nails, pseudophorus glands, sebaceous glands, and ceremonous glands. First, the epidermis is the most superficial layer of the skin that covers most of the body. The epidermis consists of stratified squamous epithelium and is responsible for providing mechanical protection and keeping microorganisms out of the body. There are 4 cell types in the epidermis, which include keratinocytes, melanocytes, Merkel cells, and Langerhans cells. However, the most epithelial cells are located in the keratinocytes. The epidermis is arranged in 5 distinct layers, which include the stratum basal, stratum spinosum, stratum granulosum, stratum lucidarm, and stratum corneum. The next layer is the dermis. The dermis is deeper to the epidermis and consists of loose connective tissue and connective tissue fibers. The dermis is arranged in 2 layers, the papillary layer and the reticular layer. The papillary layer is the most superficial layer of the epidermis and is composed of loose connective tissue, vessels, nerves of the skin. The reticular layer is the deeper layer of the dermis and is composed of dense, irregular connective tissue that surrounds blood vessels, hair follicles, nerves, sweat glands, and sebaceous glands, and so on. The hypodermis, or subcutaneous layer, is composed of loose connective tissue and adipocytes, and is responsible for stabilizing the integumentary system. The subcutaneous layer is interwoven with the reticular layer through the connective tissues. However, the subcutaneous is not usually part of the integumentary system, but it does play a pivotal role in positioning of the skin. The subcutaneous layer also helps reduce heat loss, acts as an energy reserve, and a shock absorber in the form of baby fat for infants and children. This role does change as we grow older. In the future, I hope to work as either a trauma surgeon or a neurosurgeon. The anatomy of the skin will play a pivotal role in this profession, as we need to make proper incisions and closure of the skin throughout the surgical process. Specifically, the role of tension lines would be significant in this process. As we previously learned, collagen fibers are arranged in parallel bundles that are aligned to resist applied forces and stresses against the skin. These fiber bundles establish tension lines, or also known as cleavage lines, on the skin. This is pertinent to my future goal as a surgeon, because when making an incision, you would want to make the cut parallel to the tension lines to ensure that it stays closed. An incision that was perpendicular to any of these tension lines will not remain closed, because the elastic fibers will reopen when recoiling. Additionally, the cutting parallel to these tension lines will minimize scarring, which is important in maintaining the patient's life. Thank you so much for listening. Have a wonderful day.